Good morning, everybody. My name is Femi Oke. I am your Day 2 plenary moderator. This plenary will be conducted in several languages. If you don't have an interpretation device, now is a good time to pick one up from just outside of the theatre. Channel 1 is in French. Channel 2 is in English. Channel 3 is Portuguese. And Channel 4 is Spanish. If you don't get up and you don't have a device, I am in awe of all of the languages that you speak fluently, except for this one, which is Indigenous South London. Welcome, everybody. Good to see you. Oh, North London, South London, kind of the same kind of thing. All right. Hello, my tribe. So today we are going to delve deeper into what will accelerate clean energy to save lives. We're going to be looking at health sector leadership. But before we do that, who was here yesterday? Please raise your hand. Okay, very good. If you raise your hand, tell the person next to you what you enjoyed the most about your yesterday. It could be the dinner you had at the end of the conference, but I'm hoping it's something to do with the conference. Do go ahead, have that conversation, share your recap while I move across the stage subtly, and no one will notice the movements. Okay. We start our conversation with a story of the city of Santiago. Patricia Paston is the head of the Department of Environment, Biodiversity, and Climate Action in Santiago de Chile. Patricia, it is so great to have you start the session. Like, that is a huge responsibility, but I know you're up to it. When you stand up, you'll be amazed at the round of applause that will accompany you standing up and walking up the stairs and to this place. Patricia Paston, welcome to the stage. A little more, please. Thank you.
Thank you. Thank you so much. I would like mention I am very happy to be here. So I speak Spanish now. En primer lugar, me gustaría.
So first of all, I would like to greet everybody, all of the attendees, and to thank the invitation from Santiago for this conference of air pollution and health. The metropolitan area in Santiago, maybe some of you are familiar with it, but it is one of the biggest cities in Chile. It's the city capital, with about 8 million people and a surface of 15,000 square kilometers, an equivalent of about 2% of the national territory, with a political administrative division of 52 comunas put together in 6 provinces. And for the first time, we have the first democratically elected governor and a second round. He is Claudio Orrego. He couldn't be here today with us, sadly, but he's very happy that we are able to represent Santiago. So Santiago has assumed a commitment, the commitment to reduce GHG emissions in a 45% by 2030, and to make it a carbon neutral region and resilient by 2050. Because if the current scenario remains, there will be a large reduction in the precipitation rates and an increase in the annual median temperature of 2 centigrades, droughts and fires. Because for the first time in Santiago, like 3 years ago, a document was issued about extreme heat protocol led by Governor Claudio Orrego, who also wanted to have the first Department of Environment in a regional government in Chile. And in regards to climate change, all these effects, all of this contributes to increase air pollution, black carbon, ozone, methane, etc. Regarding the first regional action plan on climate change led by a regional government in Chile and funded by the regional government, it was established that 30% of those interviewed have said to be exposed to air pollution. Now, heat islands on the other side also increase, in a way, this environmental contamination, causing an increase of GHG gas due to the use of power, which we know that vulnerable population, in this case are small children, senior citizens, pregnant women, and for that, we have a plan, the regional plan of climate change in the metropolitan area, that although there are entities that do not depend on the government of Santiago, for example, the ministries of energy, transportation, ITs, we are doing our best effort to be able to help to go toward carbon neutral, to improve conditions and the cost of clean technologies, aiming to improving air quality via prevention and air decontamination plans, to expand new responsible infrastructure, and an effort with the various sectors from the ministries of energy, transportation, telecommunications, and health. We also have big projects of urban tree planting that, you know, this brings into biodiversity, the well-being of people, good shadows, and of course CO2 capturing. Hence, air, which is vital for all human beings, and being threatened by pollution affecting our health, that we want to make a call from Santiago for future generations to be able to breathe free air. And to wrap up, I want to thank for this invitation and send you warm greetings to everybody.
Muchas gracias, Patricia. Thank you for our session off. In our session today, we will also be taking your questions. This conference, more than any other, has as much expertise sitting in these seats as you will hear on this stage. As you hear the speakers, if you think about questions or comments, things that you want to share with your colleagues here in the conference, please do be thinking about them, and then towards the end of this session, we will have the Q&A. My experience is the Q&A is often the most dynamic part of the entire session, so I'll make sure that we have time for that. Our first panel, I will call to the stage Alberto Maluf, who is the National Secretary for Urban Environment, Water Resources, Environmental Equality, Ministry of Environment and Climate Change in Brazil. And Alberto, your business card must be huge to put all of that in it. Please come and take a seat, the second one from the side, so that we can sit together. Ashwin Vasan, please join me on stage. Menschel Senior Leadership Fellow, Harvard T.H. Chan School of Public Health, former New York City Health Commissioner. Thank you. Natalia Linu is the Deputy Director for the Health Team for the UNDP. Please come to the stage. And can you believe I am looking for a panelist? Has anybody seen Sebastian Denis? Has anyone seen Sebastian at all in the last 2 days? If you see him, tell him I've kept a seat warm for him on the stage. And in the meantime, I will continue undaunted. Thank you, panel. Welcome. Take a seat. So I'm going to get you to hear from the panelists first of all, as you work out what questions you might have for them, really where their stance is when we're talking about tackling air pollution and climate change, looking at better health in the framework of the SDGs. That's our mission. Hello.
Hello. So,
I'm not a prophet, but I feel like your name could be Sebastian Dennis.
right, you're true.
Sebastian,
Hello to everyone.
explain yourself. What happened?
Well, I had to solve a problem with my translator. So sorry
okay.
for that.
All right, okay.
But
well,
I'm there now, so we can go.
All right. It's lovely to have you. Thank you for adding extra drama to our conversation, Sebastian.
And
It's
it was
good
also
see
to
you.
keep attention from these people
Sure.
who were just
Nobody
trying to
noticed,
sleep.
Sebastian. Nobody noticed you just
No,
coming on
it was
stage
very
just
discreet,
then. Adalberto, I want to ask you about what was the main motivation for cleaning up the air in Brazil? If you had to put it in a nutshell, what would that motivation be?
Well, thank you once again for the invitation to be here. Well, our Minister of Environment, Marina Silva, she has been pushing us a lot to do public policies based on evidence, based on data. So we started doing this, creating all the indicators, the national inventories, all the plans, doing all these things. I was commenting with my colleague here that 2 years ago I had the chance of doing this early childhood course in Harvard Chan University. And at that time, something kind of struck me a lot, because since my daughter was born, I say everybody that everything I do it to protect her. And yesterday, as we heard Ellie, and the story of this girl that, passed away with 9 years old, the same age as my daughter is now. So when we were pushing for the National Air Quality Agenda, we approved last year the World Health Organization standards for air quality. And we did had a lot of pressure from the industry, from all the different ministers and everything. But when we quoted most of the policies that they were to protect early childhood, I think the resistance of majority of the stakeholders, including the Minister of Industry, which is a doctor, he is a physician, the vice president, was reduced. Because Brazilian Constitution is very clear. It says that on Article 225, everybody has the right to a clean and safe environment. And later it says that it's with absolutely priority, society, government, all stakeholders have to protect early childhood. So I think when we realized that, the national inventory of chemicals that we approved last year, the national monitoring of pesticides, the national monitoring of water quality. Last year we launched like 10 national systems. All of them, somehow we coded it as a way to protect early childhood. And I think with this narrative, it was very difficult for the other stakeholders to go against us.
Okay. Very compelling. Ashwin, medical doctor, epidemiologist, you come with some heft to the stage. We don't always link health with air pollution. Sometimes we think of it more of a policy idea, policy framing, not necessarily health. But you come with data. Like that data is critical for getting to solutions. Tell us more.
Yeah, so very glad to be here. Mucho gusto de tenerme aquí. And I'm in a very reflective mood as someone who's left public service recently in the United States, coming to a place, WHO, and to an international forum where I got my start in my career at a moment when global cooperation is sort of being threatened. I apologize if I come across as a little bit reflective in that mood, but one of the reasons I'm excited to be here is that the work on climate change and health reflects the best of a comprehensive approach of both grassroots action, bottom-up innovation, community-led work, but also grass-tops ambition and cooperation, the kind of which is on display here. And so in New York, health in many ways is, through data, but also through action, is an important organizing function at every level of our work. And so let me just describe sort of three things that we've been working on over years. And Natalia was a former New York City health official as well, so some of this was built during her time. Looking at the bottom up, we've used health to outline and data to identify which communities are facing the disproportionate impacts of air pollution on things like childhood asthma. And then using that as a means to invest in those communities through what we would say are place-based approaches, to empower community organizations to organize, to connect people into care, into primary care screenings, to early identify people, get them on evidence-based treatment, even in the face of an air quality that has deteriorated over time or that is structurally worse in certain neighborhoods than others. And so that represents the best of a community-led approach, where groups, fantastic community-based organizations, are organizing the people to both advocate for change in their environment, but also to get people the material care and connection to services that they need in the immediate, in the face of long-term change happening. The second is, how do we unwind the structural elements of why certain places and neighborhoods have worse air quality than others? And recently, in 2022, we commissioned a study of something in New York City, for those of you who have visited, something called the Cross Bronx Expressway. It is a massive, massive 6-lane highway, that runs through the middle of some of the most diverse and lowest income neighborhoods in New York City, and was built in the 60s. And the result of that has been not only the industrialization of these very rich and diverse communities, but a deterioration in the environment around it. And so finally, we commissioned a study funded by the previous federal administration and in collaboration with, led by health, led by transportation, led by city planning, to start to say, how do we unwind those impacts? And lastly, it would be remiss for us not to talk about the grass tops. Congestion pricing just went into effect in New York City in January, and already we've seen 1 million cars less entering the city in its first month, and a massive increase in public transport usage, almost 10%.
So Ashwin, that date for when that congestion charge was due to start, just very briefly, was pushed back. Because why?
Politics. And I spoke out about this. I spoke out about this at the time that it was pushed back, not being clear whether it would get revisited.
Right.
In the midst of a federal election, in the midst of local elections, the governor decided to press pause. Thankfully, she revisited it and brought it back after the election.
Okay, I will revisit you in just a moment.
Please.
I'm going to move on to Natalia. Natalia, when we think about the UNDP, we're thinking about coordination on a massive regional country scale. We're talking about governance and tools for better governance. We're not necessarily thinking about health or even air pollution. Can you connect the dots for us?
Sure. Thank you so much for having us. And yes, UNDP is known as the UN agency that's responsible for poverty, inequality, governance, human rights. But as we have heard over the last few days, air pollution, the sources, whether it's energy or buildings or waste management, those are development challenges. And I think what UNDP is trying to do is reframe the conversation from one where it was, in order to develop, you have to go through these polluting industries, and to one where you actually don't have the choice. You have to see development hand in hand with sustainability. So UNDP has a very strong climate team. We have a chemicals hub, we have an energy hub, as well as very strong governance. I'm the deputy in the health team, and so I'll frame it a little bit of how we think health fits into it. So with the support of the European Union, the last few years we've been we know that our colleagues and our partners on the ground, whether it's ministers of finance or development, their top priority isn't health, although the health narrative, as my colleague mentioned from Brazil, is very powerful. The other very powerful narratives are economics and then the political, as you sort of talked about. So we've been doing a lot of work around those two places. So setting up methods of investment cases to do economic investment cases with local data. What is it costing you? What is it costing you in terms of your healthcare costs, which obviously are going up, but also labor, absenteeism, or presenteeism, losses in school education? What is the economic cost of air pollution? And then in parallel, we match that up with something called the legal environment analysis, where we look at, what are your laws on the books? Where's the implementation happening? Where's the pushback, industry interference potentially? Who are the stakeholders at the table? Because we really believe that that political analysis, along with the economic data and the health data together, can support multi-sectoral action. and that we go together with government partners to build that case and to do sort of that work. Another big piece that we're working on right now with support from the Clean Air Fund is to integrate air pollution into the NDCs. So that's one very important way where governments are setting their priorities. And if air pollution, especially super pollutants, are there, we think that there's a chance that the government will take it seriously, but also for future financing. So UNDP also cares deeply, not that we have the plan, but that the plan is accompanied by financial, sort of the know-how, as well as working with the private sectors and others. So we work along the sort of governance behind the scenes, multi-sectoral action at the policy level. And then at the country level, we actually are the biggest implementer of a lot of the GEF, GCF, also the fund. So we have a lot of implementation know-how.
Could you give us just one example? Because
Okay.
I'm talking like you're giving us broad-based, this is the work we're doing.
Yeah.
I'm not hearing a single country.
I'll tell you, in Zimbabwe, for example, UNDP is the PR for the Global Fund. And with savings from the Global Fund, we were able to electrify the entire health sector. And the Minister of Energy is basically saying that 30%, they're able to now, by having solar panels on their entire... So the motivation was health. The motivation was, how do we keep these vaccines from, sort of temperature stable? But in the end, there was a clear win-win to electrify the health sector. So that's like the Zimbabwe example. But we have, in cities like Dhaka, and other places in Singapore, in Argentina, in Buenos Aires, UNDP is bringing digital innovation to some of the monitoring and technical. So UNDP has a country presence in 150 countries, so it would be difficult for me to draw on just one or two examples.
Sure.
But our clean energy portfolio is huge. But again, when our energy team thinks about it, I don't think they're necessarily thinking health. They're thinking energy access, poverty alleviation, gender equality. And where I think the connecting the dots has to happen is, and what are the health benefits? So then when you're talking to a minister of planning, you can say, yes, we're doing this for energy access, and you're going to benefit in these sort of millions of dollars in averted costs of hospitalization. So there's a lot more of connecting the dots that can happen.
Ashwin, you look like you're dying to ask a question. Unleash it.
No. I mean, really, I have always thought, and we worked on this in my time in New York, how do you bring health together around a coherent view that it has something not just to say, but something to do in mitigating the impacts of climate change? Just take, we built the first climate and health program in any municipality in the US, and it was organized, of course, around heat, air quality, flooding and flood prevention, and vector-borne disease. And across each of those domains, we're doing different things, and yet, to Natalia's point, it's both an opportunity for health to bring people together and shine a light, but it also makes it concrete for people. These targets about greenhouse gas emissions or temperature changes, they are abstract to everyday people. People do not know how to get their hands around it, even though they're living it each day. And so I think health offers both the data to organize the approaches to bring together action, but also a really important anchor for people to say, wait, I'm not powerless in this fight. I have agency. I have something we can do today, not just targets in 2030 or 2050 or what have you.
Adalberto, pick up your microphone, please. What is going through your mind right now? Your microphone is on.
Yes. No, as he was saying about the importance of the health sector, I was realizing how much that everything that we delivered last year on air quality and that we are about to deliver in these next 2 years, everything happened because we had the Minister of Health together. First, because they brought the partnerships. They had consultants from PACO and, the World Health Organization. But especially when we had the big fights with Minister of Mining and Energy, with Minister of Civil House of the President. And it's always the Minister of Environment against a lot of big guys. But at least in these cases, they were always backing us. And I think if we didn't have this partnership really smoothly moving, probably we wouldn't have delivered on the timelines that we had. So that's what I was thinking while we were talking on.
I was trying to envisage what a big fight would look like? Who's your sort of your wing person? Who's there to support you? And what is the fight about? Is it about money? Is it resources?
No,
Priorities?
it's not only resources. It's about who gets the priority of the public policies. All public policies, they have interest. Normally, when you create something that it's a public good, like air quality, you're not going to have manifestations of thousands of people in the streets. We want air quality. We want air... No, but if you do something on the truck producers, on the bus producers, on the industries, they will put a lot of people there. I saw this when we did the air quality standards, like the vice president called me. You know, it's cool, you know, like national secretary is calling me, like the presidents of the industry.
Sure.
They say, oh, they said that you push it too much, you know, you had, the limits are impossible. I said, no, it's not that, come on, let's talk about it. But I think Minister Marina, that, you know, her whole life she fought for the forest. But then suddenly she realized that she was actually fighting for the planet. And right now, I see her best partnership is the Minister of Treasure. He's the guy that speaks more about environment. But when Fernando Haddad was mayor of São Paulo 20 years ago, I used to work for the city of São Paulo. Then he became mayor when I became C40. So I was C40 director in Brazil while he was mayor. And he was not an environment guy. He's one of those guys that, you know, it's all about social desiguity. So social desiguity reduction, economic development. So he was a good mayor, but environment wasn't there. But then suddenly, 20 years later, when he becomes the Minister of Finance, after everything he learned with the Minister of Agriculture, with our Minister of Environment, he is our champion. So I think that's why Brazil somehow is delivering so much on so many areas in environment, because who is leading the work is the Minister of Treasury, is the Minister of Health. And we are, you know, the, I don't know, coadjuvant. You know, you had like the main actor on the Oscar, and you also have that Oscar for the second, more important. I think that's our role. You know, we are not the big guys on stage. We are backing the important people that they are moving the agenda, you know.
Supporting player, best supporting player. Excellent. Sebastian, I'm thinking about Santé Publique France and multi-sectoral approach to clean air. What can you share with us? What can we learn from what you're doing?
Well, thank you for having me to this panel and very interesting interventions from my colleagues. Thank you very much. So air pollution is really a problematic regarding health, and intervention on air pollution is a major public health intervention. Of course, Santé Publique France is a national public health institute, and it has to make some recommendations to the government, and our first target is Ministry of Health, as we're dependent of Ministry of Health. However, we use the health argument as a strong argument to try to make other sectors acting against air pollution. To do that, we use a powerful tool, which is the quantitative impact health assessment. So it's a kind of tool that allows to gather epidemiological evidence, and we've seen that we have a lot of epidemiological evidence, to try to estimate the number of incidence cases or the mortality due to air pollution. And also, what is powerful in this tool is that it allows for estimation of the costs of the air pollution. And for instance, you can simulate some intervention that would reduce the level of air pollutants, and you can associate to this decrease the economic cost that the countries would save if they reach such a level. And so this cost represents several billions euros, for instance, for incidence of asthma for children. I demonstrated that, I shown that yesterday during the panel on children. And this cost can be qualified as the cost of inaction. The cost of inaction for the government acting on reducing level of PM2.5, for instance, could save a lot of cases of asthma in children, and you can also earn a lot of money. And so, of course, from a public health point of view, the first objective should be to gather all the epidemiological evidence, but we need also this estimation to try to better convince our administration that acting is really a priority and should be a priority, and that also no one should be left behind, because we know also that these actions should target the people, of course, but should also take into account the social inequities and acting also on people that do not have access to different infrastructures, for instance. So that's really, I mean, a priority for us. We work at the national and also at the regional level, because actions on air pollution depends strongly on the local level, and municipalities are really involved in these actions. And then we try also to connect the different components that will act on air pollution. For instance, speaking in terms of, and in the frame of climate change, of the increase that we can observe regarding heat waves. For instance, if the municipality acts against heat waves, it will impact potentially air pollution. And so all these compounds in the overall theme of climate change are connected. And so if you take a measure to reduce air pollution, this measure doesn't have to improve those.
Wow. All right. Okay, I'm on. Are we on? Okay, we're back after the break. All right.
Okay.
Very good. Can you tell I was a girl guide? I was ready to jump into that void. Right there. Sebastian, you were just winding up. Go ahead.
What was I was saying?
You were saying, and now I'm finished. Any questions?
Yeah. Any questions?
Yes.
No, and so
Perfect.
health is a strong argument to tackle air pollution, and you don't have to forget the other components, because all is interconnected. So very complex in terms of our political, classical organization that is really in silo. And so we should overcome this silo. That's one of the main difficulties for us.
Natalia, the power of what we're doing right now is convening. I don't think any one of us is trying to persuade another person. We're not trying to bring evidence to say, look, this is what will happen if we clean up the air. But it's great to be able to talk to colleagues and peers. Bearing that in mind, out of all of the panelists here, who are you most interested in asking a question to? Go ahead and do it.
Can I just reflect on a few things they've already said rather than ask a question?
You can
Very
reflect on
quickly.
one
question.
takeaway.
I think the industry interference point that my Brazilian colleague made is really important.
Yes. Yeah.
You know, fossil fuel industry, the health community has done a lot to, tax tobacco, and we know the health harming, but we haven't quite gotten there in the conversation around subsidizing fossil fuels and, kind of understanding that the opposite of, the taxing, and sort of how strong is the industry, whether it's agriculture or energy, I think the political arguments, and then from an equity perspective, I'm really happy that this was brought up. The poorest people who are feeling this the most also have the least political voice and power, and governments and politicians can just, they're unlikely to vote. So UNDP is trying to get more people to vote, elections, and, how does that fit in if we had a populace that was actually, so question on equity and industry interference is my.
Sebastian, tackling air pollution and climate change, in one sentence, what is the most important thing that we should be focused on in the next few days, in your opinion?
I think as epidemiologists, we need some research data regarding the interconnected impact of the different risk factors that we include in this, in the impacts of climate change. For instance, we have air pollution, we have new pollutants that might appear, we have the fight against loss of biodiversity that would also be impacted by air pollution, and we need epidemiological data to integrate these different compounds in our estimation of impacts, and I think that's very difficult. And then we also need maybe to increase our political awareness using advocacy, I would say, and also involvement of different communities at the local level, also very important.
Ashwin, in one sentence, what should we be focused on?
Building. I truly believe that, you said it yourself, we're not convincing each other of the importance of these issues. Health is an anchor and an important lens through which to try to persuade others who may not understand this issue or be as inclined. Political voice is important, but at the end of the day, we have to build clean energy. We have to build the alternative solutions. We have to green our buildings and our health systems, and we have to get going. And that means working with markets, working with the private sector, working with whomever has the capital and the means to move, because that's what's under test in the United States and in Western democracies all across this country, is the fact that we're not delivering. We're talking and we're not delivering.
Natalia, go ahead. That one thought that you wanted to leave us with that we really should be focused on.
I mean, I think just echoing what was said, health is really important right now, this moment. There's a political, as we're seeing political movements, it's being defunded. Be thoughtful on how you bring health to the other sectors, not only to make a narrative case for sort of children and pregnant people, but the financial case. Really making the case that the cost to a government of inaction is going to far outweigh the cost of action. And so, yes, it's a political difficulty to build, but the cost of inaction is going to be much higher.
Adalberto, go ahead.
Well, I think for us, the focus is implementation. Implementation. Because, of course, we have to plan, we need the data, we need the indicators, but sometimes we spend so much time on refining everything and trying to make it the perfect one, and we lose the political timing, as we saw. So we really feel now, after 2 years of doing all these national plans, all the systems, that right now we have to implement, deliver, action on the ground. And to do that, we need to bring our mayors on board. If the mayors are not on board to deliver, most of the things we are doing could probably not deliver. And in Portuguese, there's a phrase, it says, best is the enemy of good. I don't know if you have something in English. But on public policy, for me, I'm positive. We can only deliver the good things. We can't deliver the best. It's impossible because of the politics of everywhere. So let's just focus the good. When it gets good enough, just deliver. Then later you can improve it.
Would you like to speak to Sebastian, Natalia, Ashwin, Adalberto? I know you do. Towards the end of our entire session, before our break, you'll be able to, I'll bring them back and you'll be able to talk to them, ask them questions. But for now, please thank the panel. Thank you. Thank you so much. You just walk off this way. Thank you very much. Excellent. So I am a journalist. Thank you, panel. Please be careful as you go down the steps. Don't trip. Excellent. Although Ashwin is a doctor, so Ashwin, you don't trip, but anybody else can. And I know you'd look after them. I am a journalist, so I know the power of a great story. I know the power of testimony, which is why we have a testimony story included in this session. Dimitris Kontopidis. Let me try that one more time. Dimitris Kontopidis is going to tell us his story. He is the the chair of the European Lung Foundation, and he has a profession which has nothing to do with his health needs, but his health needs has everything to do with this conference. As I respect storytellers, I'm telling you nothing. I'm leaving everything for Dimitris to do. Dimitris, as you walk on stage, the crowd will go wild.
Hola, buenos días.
Hello, good morning.
But I'll make my try. Since I have a welcome, and I want to express my story that I came from Greece to tell. So as you already have heard, is that I'm an architect, and it has nothing to do with health. And if I could say very quickly my story, I will share these 4 points that you already see some personal photos. Except from architect, I'm cystic fibrosis patient. And what does it mean? It means that when I have born in 1980, the average of survival in Greece was 20 years old, while in other European countries like Brussels, like UK, was 10 years more. And this difference of survival for more than 10 years, it's not caused by the disease, it was caused because of the difference of healthcare systems. So when I realized that, I understand that I have paused my career, I have paused my dream in order to find my pathway to survival. And this is more easy when you are losing your co-patients every month. Because if you have heard what happens in cystic fibrosis, except from a lot of medicines, except from physiotherapy, we need to hospitalize a lot of times per year. And we were making photo with my other co-patients, and in order to make a joke of the disease, we were counting who will not be in the next photo. So when you live this kind of moments in your life, you are definitely need to take an action. So in order to be protected and being more expert, I make a master in public health, and the last 15 years I'm involved in patient advocacy in order to protect my health, to survive, and to do something with the rest of the patients. Since then, I have been in a lot of positions in Greek Ministry of Health, in European and national organizations, like the European Lung Foundation that I'm representing today, a patient expert for better health. The little fact that I will share to you together, that it's connected with our topic, is that I'm living in Athens. And since 1 year and in Athens, I need to make intravenous therapy every 2 months for 2 weeks. Why? Because my lung function is less than 30%, and I need a lung transplantation. Before 1 year, I moved to an island, to live in an island, in order to be an architect for touristic places. And what happened then, for 1 year now, I didn't need to make intravenous therapy. And this is a fact. Maybe it's for clinical study also. Why it happens? I knew that air pollution is a risk factor for lung health. Not only the one, but it's an important risk factor. And as you possibly know, in the capitals, Athens of Greece and the capitals of all the countries, we have a lot of difference about the PM 2.5 numbers. And this is the connection with the today's topic. I'm lucky that I know a lot about DALYs, QALYs, about the improvement of health, about policy. But there are a lot of patients that they are not aware of it. You possibly know that it's more 250 registered registered asthma patients globally. Another 200 COPD patients registered because there are a lot of them that they don't know what they have. And this is the reason that we need to raise the awareness about the factors that can harm your lung and the health generally, because it's not all about the lungs. And I'm finishing my small presentation with this call to action. People outside the chronic disease, we say that we're invisible disabled people with invisible disabilities, but also their pollution is invisible danger that we cannot understand. The chronic patients, we are close with the doctors, and we know to take some facts to protect ourselves. But the citizens out there, they are not aware of all of this harmness. So the better thing that we can do is working together with the doctors to explain in a very understandable way to the patients and to the doctor to make the appropriate campaigns and to use the power of data in order to keep the health quality and the quality of living for everybody together. So that was it. Thank you very much. And the rest we can share after. Thank you very much.
Dimitri, thank you. Dimitri, you can also speak to in our Q&A session, which is the end of this session before we go to our break. Now, when you woke up this morning, did you think you would hear about the National Firewood Substitution Plan for Colombia? No, I know you had no idea that that was about to happen, but one person in this room knew that was about to happen, and that is our next speaker. Mauricio Andres Palma Orozco is the Under-Director of Hydrocarbons, Mining and Energy Planning Unit in Colombia. Mauricio, thank you so much. The microphone is yours.
Hi, everybody. Well, I'm going to present the National Firewood Plant Substitution for Colombia. I'm going to do it in Spanish. And just to let you know, it's the same, well, the international level known as a clean cooking program, okay, but for Colombia. Bueno, entonces.
Then we begin with our presentation. Yesterday, during a session, this event, I presented what was the national plan for firewood substitution in Colombia. And real quick, what we talked about as a view of this plan was to give every household a different alternative than firewood and inefficient fossil fuels that are highly pollutant. We have GOP, natural gas, biomethane, and electric power. However, when we started looking at the plan, a plan that was published back in 2023, we've already had an interesting breakthrough in terms of planning. We have a view by 2050, but we've realized that the reference in the plan that we have tackled once we've implemented it, we need to create scenarios that could come closer to the reality of its enforcement in Colombia. So we created a couple scenarios that are less ambitious, and with them we have a middle case scenario that brings that target down a bit that we have for 2050. And so the idea is, what if we prioritize electric power and reduce fuels, in this case GOP and natural gas, and we have a third case scenario, which is the current journey. It's a little bit the other way around, what you would expect to have a grassroots scenario and then grow more ambitious scenarios, but we've noticed that the enforcement of this has been a bit difficult to achieve. So what we have learned during these 2 years that we've been publishing these elements in the document for this plan is we found that we have the most important considerations in the fact that we need resources and sustainability and the investment that we need to have. And we need to also have cultural acceptance. The firewood cooking in Colombia is a rather cultural thing. We have some typical cuisine that makes us use it, but we're trying to replace it, and we're using a different approach. We also have, in addition to it, the infrastructure and logistics to be able to achieve that substitution, that replace from the part of the supply. So far we're talking about health. In this case, we also have to consider and mention that it has to do with the mining sector. So we have the supply and the resources that we need to use for that substitution, and then we also need targets for short, mid, and long terms. Thinking back in 2023 with the initial step in the publication of the document. In this paper, in 2023, we created the Interinstitutional Technical Unit for the firewood replacement, and we have had more than 6 sessions between 23 and 24. And we started including the various sectors that are participating: the Ministry of Health, Treasury, Science and Technology, Environment, certainly. We have the Ministry of Equity and Culture, because this is an interinstitutional approach that we need to have. And we have focused in order to selling these plan and the replacement of firewood, not only from the energy sector, that's the champion in Colombia, but also from the standpoint of access to clean air, looking into climate change, reduction of emissions, air quality, housing, technological innovation, and in addition, healthcare and cultural transformation. So in that sense, we've understood that what we have to start substituting, replacing here is not so much the supply, but the approach of what is taking us to look into climate change, healthcare, and cultural transformation. Now, within this technical unit, we've identified key projects. And these key projects have to do with starting to find funders through digital platform instruments so that we can work with simulations so that they can learn about it and implement their projects. Also technical support for energy sector companies. But then the idea is to migrate to have this into healthcare companies and climate change approach entities that are also playing a role in the implementation of this plan. And in addition, to create incentives and a regulatory guideline that can lead into these biomethane and clean energies. Recently, our participant from Brazil in the panel had said that the implementation is what we need, basically in South American countries, of course. We have created already a roadmap. Now we need the implementation, a word that we've heard a lot about, and this is what we are believing in. We're already working with that implementation phase to try and find resources and sell the plan. And I thank you for your attention, and also I want to thank the organizers. Thanks a lot.
Thank you, Maurizio. Our second panel is also the reason why we're here in the first place, why we're in Cartagena, which is accelerating this transition to cleaner air so that we can actually save lives. I'm going to introduce you to panel number 2. By name, they will come up and sit on the stage. Welcome, panel. Marina Ramonello is the Executive Director of the Lancet Countdown, tracking progress on health and climate change. Marina, thank you. Please take a seat. Charles Oke-Ahalam is the Chair of International Board of Amref Health Africa. Good morning, Charles. Xiaoming Shi is the Deputy Director of the CDC China. And Arunabha Ghosh is the founder and CEO of the Council on Energy, Environment and Water. It is good to have you all on stage. Thank you for coming. Thank you for staying for panel number 2. Good morning, everybody. Good to see you. Your microphone should be on. I'm going to get you to listen as well to each other, as well as some of the key points that you want to make. Marina, let us start with opportunities for accelerating transition. If we're thinking about, well, how do we do this? We know why, but how? What would you share with us?
Well, thank you so much, and thank you very much for having me here. So I work for the Lancet Countdown on Health and Climate Change, and what we do is produce data and evidence on different aspects of the links between climate change and health, one of which is the health co-benefits of that transition to a healthier future, a healthier energy system. And through our data, we can identify very important opportunities for health through health-centered climate action, through climate action that prioritizes health and well-being. We've heard a lot about kind of that 8 million deaths from air pollution. We see that very clearly from our data. We also see that 6 million deaths each year come from anthropogenic activities that lead to air pollution, which means that we have control over those deaths. And what is most interesting is that we know what the breakdown of the source of those contributions is. For example, we see that the 1/3 of those anthropogenic emissions comes from the burning of fossil fuels, and the vast majority of those comes from just 2 sectors. The power sector, mostly from coal burning, which we know we can replace through kind of renewable and cleaner energy sources, and from the transport sector, through high emissions, highly polluting activities in urban centers where people live. So that tells us already where are the sectors where interventions can be the most efficient. And one thing that is quite encouraging is that we see that from 2016, when there has been increased ambition in fossil fuel phase down, hopefully phase out, and particularly in acting towards coal, we already can tell from our numbers that we've saved each year over 150,000 deaths from cleaner activities, from reduced coal-related air pollution. So we know it can be done. And when we talk about these numbers of air pollution, we're mostly talking about the air pollution that we measure through outdoor sensors, but not even starting to scratch the surface from household air pollution. And we have estimates on household air pollution that tells us about 2 million deaths each year comes from the burning of biomass and dirty fuels inside people's homes. And that happens in the most vulnerable countries, in low middle-income countries, where people are exposed to energy poverty, and that has huge impacts on their health, not only to the air pollution, but also how time-consuming it is to go and look for the fuel, how much it takes people, generally women and girls, away from employment, away from education. So also by increasing access to clean renewable energies available off-grid in the most energy-poor parts of the world, we could not only save those 2 million deaths every year, but also provide better health and development and educational opportunities for people in those countries.
Charles, you are chair of the International Board of Amref Health Africa, one of the biggest health organizations in Africa. If we're thinking about what do we need to do, we know the what, but getting the money, that's the tricky bit. Help us get to the tricky bit.
First of all, let me say thank you very much to the organizers, WHO and everybody else for inviting me here. I'm very grateful for that. Femi, your question, but before that, I'll just say that Marina made all the points I wanted to make, so I can keep quiet now. But no. About raising funding, I think the key to this is identifying the problem very carefully. I think we face very difficult times now with the changes that we all know about geopolitically. I think it's going to call upon organizations involved in this very important area of work to be very specific with the challenge, identifying the challenge. And this is very data-driven. You touched upon when you just spoke, Marina, and I quipped about it, the issue of transportation and the challenge that that faces. Well, that we face because of transportation choices. I think that from a health point of view, you can clearly see that we are going to be faced with a continued rate of demand for transportation, for energy, because of population growth. There is no choice. If you look at Africa, and what we experience on a day-to-day basis on the continent, you see that people make choices without much, they have no choice. It's a kind of Hobson's choice. So the issue is the extent to which you can throw money at specific challenges. And if you look at transport particularly, you could say the solution to transportation issues are road charges and urban charges, etc. But that gets it wrong. You have to find a way to provide a transportation network that people select because they want to use it and it's cheap enough for them to use, and they get all the rights to be able to get the access that they would get and therefore not need to have cars. But to do that, you need money. That goes back to your point and your question, where'd you get the money? And the scale of the intervention isn't cheap. It's not, we're not talking about small numbers, we're talking big numbers. And it's the challenge of getting those big numbers, applying those big numbers to what is a very big problem. And there's no magic solution. Mm-hmm. Frankly, there is a need to identify a specific challenge and say, our challenge is transportation. To solve this transportation problem, these are the implications of the health challenges from transportation. We envisage that we will need this amount of a budget to solve this, and do it on a not national level, on a regional basis because of the benefits of doing it at scale.
Xiaoming Shi, part of our our focus is accelerating clean energy transition so we can get to cleaner air. That is something that China is working on right now, this acceleration to clean energy. Can you give us a little sense of how that is going?
Thank you for your question. In China, in 2012, just about 12 years ago, China initiated the national energy security strategy, which is with emphasis on the total cost consumption control. In the past decades, we have many measures. Just Professor Shen yesterday, he introduced the information. I think the main point is strengthening the industrial emission standards. This is one of important. The second is we upgrading the industrial boilers. And also we phase out the outdated industrial capacity. And also in the transportation, we phase out the old high emission vehicles. And also we, in the rural area, we promote the clean fuels at home in rural areas for many families. So also we have recent years we developed the wind power and photovoltaic power system in whole China, and also in the transportation we have the high-speed rail system between cities, and also have the subway within cities. So this is most of the measures in China in past 12 years. And this work is very efficient to save the lives in China. The concentration of PM2.5 have a 60% reduction in the past about 10 years. And also in the slides of Professor Sen, we saved about 560,000 premature deaths. And also we can save many patients hospitalization and also the clinical outpatients visits. So I think in China we have a case to use the energy transmission to clean air and also mitigate the climate change.
Mm-hmm. Yeah. And what I'm hearing is also development. That goes hand in hand with development. So China is developing at the same time as cleaning up its air. Those two things go hand in hand. From China to India, Anuba, founder and CEO, Council on Energy, Environment and Water. How are you working with the government of India to help accelerate cleaning up the air in India? What are you doing?
Thank you, Femi, and good morning, everyone. Thank you for having me here. I represent the Council on Energy, Environment and Water, which is an independent policy research institution, but I'm also a member of a statutory body called the Commission for Air Quality Management. I think just hearing from what from my fellow panelists, the way I see this is our approach has to be sort of a formula for first, plan annual. Second, monitor hyperlocal. Third, act sectoral. And fourth, win political. Let me just elaborate on that formula. We often see this kind of grand plans of massive reductions in air quality. I myself put them out in the past. But whether you have a plan for 2030 or 2035 or 2040, I think what is needed, and we heard this even from the previous panel, you need to make sure with an implementation focus that's sort of annualized. So recently I've put out a plan that from where Delhi's air pollution is right now, the average of 102 micrograms is where Beijing was about 10 years ago. Within 3 years, we can bring this down to 80 micrograms. So go from poor to moderate. And then within 6 years, you can get it down to about 65 or 60. And then within 10 years, you can bring it down to about 30. But in order to do that, you have these sectoral plans that are annualized. And that's very important to track progress because budgets are annual. Unless you link it to budgets, you don't get it. Number two, you have to monitor this in a hyperlocal way. So at my institution, CEW, we've developed a methodology of very hyperlocal pollution source mapping in a real-time way, which allows us, for instance, in the Delhi area, there are 13 pollution hotspots. So we're working with the Delhi Pollution Control Committee and the government to work on identifying those thousands of individual point sources of pollution so you can direct your resources to tackle them when there are spikes. So doing that at a ward by ward or what we call a composite ward score helps you to focus on where you need to act. And then the strategic actions become sectoral. Whether it's a big push on renewable energy, India has already become the 4th largest renewable energy market in the world. A report we put out just 2 weeks ago shows that actually by 2030, we can go to even 600 gigawatts of renewables, and that delivers the lowest cost power as well as, of course, significant reductions. Transport, again, what Charles was saying, I think aggregating the demand for public transport is a huge way to bring down the costs. Then there's construction practices. We are developing a detailed construction practice manual for construction industries to continue their operations while reducing the emissions, and so on and so forth. And finally, you've got to win political. Political will is not something that just comes from outside. It is a derivative of the function. And in order to do that, you see the wins that you have. For instance, the clean cooking program that has delivered clean cooking cylinders to about 100 million households. We already see from our surveys that the districts where you have higher penetration, you have much lower kind of, or much higher improvements in health outcomes. That then has translated into the political wins that leaders can expect. The same we see from other interventions, say on clean energy, where you create hundreds of thousands of new jobs, and so on and so forth. So effectively, we've got to link the story around air pollution into something that is linked to annual budgets, is sectoral, is monitored at a hyperlocal level, but delivers the political wins that then creates the momentum for further action.
I want to share this conversation with our attendees. So I'm going to ask Marit, who is backstage, to come on stage with the 2 microphones, distribute them so that I can see where the questions are. Do we have the microphones already in the audience? Can you stand up if you have a question so I can see where the questions are? Okay. If you stand up, the microphone will come to your hand. Like, it will come to your hand. Fantastic. Yes, Charles, go ahead.
Whilst the microphone is going there, it's amazing how when you think that you've got a unique idea, you listen to somebody else speak, you realize that your idea is not as unique or your thoughts are not as unique as you thought they were. When I listened to my colleague here speaking, I thought, and I'd listened to Marina earlier on, I thought, well, Charles, either they've got access to your phone, and because some of the notes here, I have some of the same things here. I just thought I'd make that point.
But isn't that a beautiful thing, though?
Yeah.
Because I also saw, Marina, as you were both speaking, I saw you, that nod of recognition. Can you articulate your nod for us, Marina?
Yeah, for sure. And I echo your thoughts. we're all on the kind of same page, I think, here, and I wonder what we need to do to get everyone on the same page. But to your point of the importance of gaining that political will and the importance of ensuring that in everything we do, in every policy that we plan, the ultimate goal is to improve people's health and well-being, and that's what gets you that political buy-in, if you can actually show what those benefits have been. And I think in some cases, particularly when we talk about climate change, there has been a bit of a shift away from that human-centered component of what we talk about when we talk about climate change. It's not about just protecting the environment. It's not just about protecting the economy, not just about protecting the infrastructure. It's about protecting all of that whilst improving people's health and well-being as an endpoint. And in losing track of that, the danger is that you can try to implement measures that are actually quite detrimental to development. And I think, Charles, that's what you were getting to. As the world's population increases, as we aim to achieve the Sustainable Development Goals, as we aim to kind of support the development of some economies and some countries, how do we do that while protecting people's health and well-being in all aspects, both the economic well-being, the environmental well-being, and the pillars of good health as a primary component of those interventions? And that is what gets you the political will and the buy-in. If we lose track of the impact on people's health, those interventions will never fly.
Yeah, I think my takeaway from both what Marina and Charles have said is that often in the struggles that we have, it can feel very lonely, right? And then because we're kind of in our localized setting, resource constraints, etc. But when we have conversations like this, and you have similar theories of change, similar narratives, you realize actually this is, the local can become something about the camaraderie of the global. But in order to do that, we need to create a democratic demand for clean air. At the end of the day, solving for climate change is very desirable, but the climate crisis, I believe, is only the second biggest crisis we are facing. The biggest crisis we are facing is a crisis of empathy. When we start empathizing with each other's lived quality of life, that's when we understand that air pollution is actually the great leveler, whether you're rich or poor, whether you're in an inland city or in a coastal area, whether you're in an urban area or a rural area. This great leveler of our quality of life can really help us put in the seeds of creating a democratic demand for clean air.
Let me go to some questions from our conference attendees. Please stand up. If you have a question for somebody who's not on the stage right now, I will ask them to come onto the stage, to stand at the microphone, so we leave no panelists behind. Please go ahead, sir.
Thank you. I actually wanted to bookend my colleague from New York with my question, but I will invite this panel.
It's fine. If you want to speak to Ashwin, that's fine. Ashwin, can you stand up here at the lectern, please? Thank you, Ashwin.
I will invite this panel as well to reflect on this. My name is Alberto Ayala. I'm here from the state of California. I am in public service like Ashwin, and I also have an academic appointment. So, and I too find myself in a very reflective mood for the reasons that you mentioned. But when I think about what this panel is about is one of the big lessons that we can share from the state of California is the fact that the low-hanging fruit is those are the easy wins, the intervention. It's the last, that'll get you 90% of the way. It's the last 10% that is really hard and is really expensive. And I'm a fan of not letting the perfect be the enemy of the good. And I want to invite all of us to be realistic and realize that the transition to full renewable energy, clean energy, is going to take time.
All right, so I have about 10 people behind you staring at you, wondering what your question is.
So the question is,
please go ahead.
How do we implement interventions that will get us, 99% of the way, maybe not quite all the way?
Good question.
There's a lot of technology.
Ashwin, go ahead. Press the button and then the microphone goes red. Perfect.
Yeah, good. It's a good question and it's the right question, but any of these interventions that we know work have to be plugged into a larger vision of change. And that's why I'll go back to congestion pricing, right? We look at the data out of London. Now, since 2019, we see a 44% reduction in NO2, reductions in PM2.5, on the basis of bold policy that isn't perfect, and that is having some industrial impacts, some commercial impacts, some social impacts, but in service of a much bigger good. And so as we're talking about all these exemplars and bright lights from around the world in this beautiful conference, bringing together people from every reach, we have to plug it into ambitious public policy goals, and ones that are actually attainable. And I loved my colleague from Brazil, Alberto, said mayors need to get on board. Cities are essential. This is why initiatives like Breathe Cities and the Clean Air Fund are essential, because the work has to come when you can control the environment on the ground. And as a former city official, that's true. You can do so much to control the environment on the ground that even states and certainly federal governments cannot. So I think that's at least part of the answer.
Thank you, Ashwin. Charles.
Yes, I was just going to add, you see, when Xiaoming spoke earlier on, he spoke about the efforts made in China, okay? But if you have the size of economy of China and you have the kind of political will that the Chinese have to solving issues, determination to solve issues, then you can get that kind of focus, not just at a sectoral level, but a national plan that is dragged down and then placed at a, and placed within the mind and within the way that people live, with the choices that they make. And then money is applied, finances are applied to solve these problems. Now, in many countries, we simply don't have those resources. And the resources that we do have, unfortunately, sometimes aren't as effectively applied, to answer your question, aren't efficiently applied. And that's the reality, right? And if you need to do these things at scale, how do you do them at scale without the resources?
Charles, let me push you. Implementation was the question.
Yeah.
What is your answer?
My answer, specific answer, would be that we need to apply money more efficiently.
Okay. Thank you.
Hola. Mi nombre es
Hello, my name is Marta Herrera. I'm a journalist, and I lead the Colombian Foundation for Lung Cancer, COPD, and other respiratory disease, and the Colombian Association for Cystic Fibrosis. I am part of ARF and ERF, two global movement for respiratory diseases. I want to welcome all of you in Colombia to my beautiful Colombia, and my question is clear. What have you done to protect your social leaders? Because in Colombia, they are killing our social leaders for advocating clean air, for defending environment. What have you done in your countries so we can apply it in our country and continue protecting our social leaders, so you don't need to leave the countries or their families need to migrate or cry for those social leaders that are being killed?
Hola, yo soy argentina.
I'm Argentina. I'm from Argentina, and we have a similar issue and problem in Argentina. I think that many industries and economical powers, they are always judged. Well, I'm not going to talk about personal. We can talk about this later on. But from the academia, we are trying for evidence to be available for all organizations and organisms that need to use it in order to take forward those changes. And this evidence comes from entities and authorities that cannot be objected, like to give validity and legitimacy to that argument of those advocates on the other side. So this is our strategy to empower through science to those who are taking the flag. Now there's an enormous problem with what you are saying, with this repression activities that many times are not legitimate or legal. So there's another thing that goes deeper that needs to be treated, and without the activity of, or the action of those activists that are really struggling on the ground to move forward many activities that protect nature, we won't be able to move forward. I think protect the activists and advocate for activists and their human rights of those who protect the environment will be respected is something we need to have of a flag.
Not just activists, you know, we all have a right to live, so we all have to be protected. But I would just want to expand the definition of what you mean by a social leader, and not just the one directly advocating for, say, cleaner environment or cleaner air, but much more empowered communities. So I want to give, you know, a couple of examples of, from what my organization has been doing. In the state of Punjab, in the north of India, we worked with the drivers of tuk-tuks. And the way it works is you have these little unions in different neighborhoods. Each of those little unions has a leader called a pradhan. So we spent a whole year working with them. Rather than just thinking of themselves as drivers of tuk-tuks, they then become the social leaders for driving the change from a diesel tuk-tuk to an electric tuk-tuk. They then work with the municipal corporation and the municipal commissioner. We then made a video and a song and a music video, including them and the government officials. And within a year, then 1,200 tuk-tuks shifted. But in the process, 300 of them became tuk-tuks run by women. And that's not usually the case that you see in India's cities. So you create these new leaders who are not leading an environmental organization, but are empowering their own communities. Another example, in another state, we've trained 20,000 women as what we call, you know, the translated, it will be electricity girlfriends. So basically, they are the local...
Wait, hang on. What?
Yeah.
Electricity girlfriends?
Yeah.
How does one become an electricity girlfriend?
So basically, they're women in the villages who now have become the collection agents for the bills that otherwise don't get collected. Because then you're capitalizing on their social capital of their community leadership, right? And in the process, helping them, of course, you know, for every bill they are collecting, they are getting a direct payment into their own bank account. But literally, we'll release the results in a few weeks. We are literally talking about well over hundreds of millions of dollars of collections. A third final example is we've got a program called Powering Livelihoods, where we are creating thousands of micro-entrepreneurs in rural areas using clean energy for livelihood activities, whether it is for agricultural activities or textiles or food processing, etc. Now, each of these, you know, about the 20,000 micro-entrepreneurs that we've created in about two years, then is an employer of additional number of people, opening up access to finance, etc. What I'm trying to say is a social leader in the environmental space is not just the one who is the activist, you know, facing the threats, but if we expand that definition and work with communities to empower them in rural areas and in urban areas, I think we begin to see many more examples that can create, again, as I was saying, a community of solidarity that is needed for us to all put our shoulders to the wheel for what is needed to be done.
Let me just
Can I add something, Femi, sorry, just on that point, because UNDP works, UNDP, I mean, I think an institution we haven't spoken about is the sort of human rights institutions, national human rights institutions, and they're critical. UNDP works with them not only to defend the right to a clean environment, which is, you know, in the laws, but also in countries to defend the human rights of activists. And there are good examples from Mongolia, from Norway, from around the world where the law has changed to protect environmental activists. And so linking up with human rights, national human rights institutions is critical. And I think especially for young people. You know, we're seeing movements of young people on social media, and the risk of violence is there. So UNDP does a lot of work around digital violence against women candidates in politics, but young people, climate activists, you know, ensuring that there is a way for protection and then justice if they are threatened is very critical. And so the whole human rights lens has been a little bit missing in this conversation, but is very, very critical to highlight.
Oh, thank you so much for coming to the lectern. I really appreciate that. Very important. I've got time for one more question. If it's a brilliant question, you can ask it. Oh.
I don't know if it's a brilliant question.
Let's find out.
My name is Karoy Illy. I'm a pediatrician, and I'm also the CEO of the Dutch Lung Foundation in the Netherlands. A few years ago, we kind of drastically changed our wording regarding not talking about clean air, but about healthy air. Some of the panelists here and other panelists, they were talking about clean air. The password of this conference is clean air. We find out that if we talk with politicians, both nationally and locally, it helps. It really helps, and especially in this current political climate. So I was wondering, would that be something that we could encourage not only in the Netherlands, but also globally to talk about healthy air and not about clean air?
Let me ask that to Shaman Shi.
Yeah, from my viewpoint, I think the clean air is very important, because for air quality, we have a lot of study about it. We know we have no threshold for the pollutants of air pollutants, such as PM2.5, have a low threshold. So we can use the healthy air. But I think for the government, for the citizens, clean air is more important. Yeah.
There's a split. Okay, Charles, go ahead.
Well, I think that question of whether it should be healthy air or clean air, if I get you right, that was...
Yes,
the question.
if you... There's an impact to the words.
Yeah, that's right.
And if the way you use the words might actually get what you want easier if you change it.
Exactly. And what I was thinking was that if you redefine it to the extent that you can make progress, if you say that clean air is like 100% and you want it to be totally clean, but healthy air perhaps is a position where you work towards clean air, but you're not quite there, if I understand you, and you're able to survive and live with healthy air, even though it might not be fully clean, might be a step in the right direction. But my worry about that is that what then is the definition of healthy air? I'm sure that you have that definition because you've obviously thought about it and moved from calling it clean air to healthy air. I'm pretty sure that given that you're a pediatrician as well, you've probably done some sort of work on that. I mean, if it helps to meet the objective of working towards clean air, then I'm all for it, right? If it's a kind of like a stepwise approach to getting to clean air.
I feel we could have an entire session on clean air or healthy air, and we're not going to do that. But it's such an important question about how we coalesce together. What's the most powerful way of doing that?
I think it's a great question, but I would love to have this, given that we have translations, I would love to have this discussion in multiple languages. If I translated that into Hindi, for instance, the clean and healthy sound so different as words. In Hindi, it would be Swachh Vayu and Swasth Vayu, right? Not that different, right? So you can almost make it a little bit of a jingle. But what I'm saying is, when you talk about healthy, it's, we know that 50 out of every 100 people in the world, 54 are breathing air that's 7 times the WHO standards. 45 are breathing air that's 2 to 6 times WHO standards. 1 person out of 100 is breathing healthy air.
Or is it clean air?
Or clean air. So
right.
I have a gift for you, Femi. Okay. So what we worked with a tribal
I was about to wrap up the panel, but I'll wait until the gift comes to me.
The gift is coming. We worked with a tribal community in Tamil Nadu, in southern India, and they made this beautiful hand-spun cotton stole, and every thread is one in those 100 persons in the world. And the dark ones are those 54 breathing that unclean or unhealthy air. The lighter are those 45 breathing unclean or dirty air. Then you have that 1 person. So this stole is called Vasla, which in their language means breath. So this is a gift for you.
And on that note, as I put on my clean air / healthy air beautiful scarf, you don't get more time. Please sit down. I'm just going to say thank you so much to the panel. Thank you for your excellent questions. You have deserved the break you are about to get. But before you go to the break, let me tell you that the sessions continue in half an hour's time at 11:30. And then at 4 p, all the way through to the afternoon, the Healthy Lung and Heart event starts in the park just outside this Congress building at 4 p.m. A lot to remember, a lot to talk about. Please enjoy your break, and please thank our panel and everybody you heard from this morning. Thank you.